Imagine a virus so contagious that it spreads faster than any COVID variant we've seen so far. As we navigate the tail end of 2023, we find ourselves facing a new challenge, a new COVID variant that is spreading with alarming speed. Like a wildfire, it's sweeping across countries, leaving scientists and healthcare professionals racing to understand its unique characteristics and potential impact. This new variant is not just another ripple in the pandemic tide, it's a tidal wave, a force that's shaking the foundations of what we know about this virus. What makes it so unique? What sets it apart from the COVID variants we've encountered so far? Firstly, it's the speed. This new variant is spreading faster than any of its predecessors. It's as though it's in a rush, a hurry to reach as many corners of the world as possible. And with this increased transmissibility, it's bringing a whole new set of challenges for our healthcare systems. Secondly, it's the mystery. There's much that remains unknown about this new variant. It's like a puzzle with missing pieces. We're still trying to understand its full implications, its potential severity, and how our existing vaccines and treatments will stand up to it. And lastly, it's the change it represents. This new variant is a stark reminder that the COVID-19 pandemic is a shifting landscape. It's proof that we can't afford to let our guard down, that we must remain vigilant and adaptable. What we're dealing with here is not just a virus. It's a test of our resilience, our adaptability, our unity. It's a call to action for every single one of us, to stay informed, to follow the guidelines, to do our part in this fight against the pandemic. This is not a plot from a dystopian novel. This is the reality we're facing with the new COVID variant. Top health experts around the globe are sounding the alarm about this new COVID variant. The world of science and medicine is abuzz with discussions on the potential impact of this variant on public health. Leading virologists have voiced their concerns about the variant's potential to spread quickly. They note that its mutation pattern might enhance its transmissibility, which could put a strain on health systems worldwide. This reinforces the importance of continued vigilance and adherence to public health measures. Immunologists are also closely studying the variant's severity. Preliminary findings suggest that while it may lead to more cases due to its potential for rapid spread, the severity of symptoms might not necessarily increase. However, these are early days, and more research is needed to draw definitive conclusions. Equally crucial is the question on everyone's lips: how effective are current vaccines against this new variant? The answer for now is cautiously optimistic. Vaccine manufacturers are confident that their products offer a degree of protection, but they are actively conducting research to confirm this and to assess if any tweaks to the vaccine formula are required. The long-term implications of this new variant are a topic of intense debate among scientists. Some predict that this could lead to the virus becoming endemic, a regular part of our lives much like the flu. Others argue that comprehensive vaccination and booster programs can help us keep the virus under control, turning it into a manageable health issue rather than a global crisis. The consensus, however, is that this new variant is a reminder of the virus's ability to change and adapt. It underscores the importance of global cooperation in tracking variants, sharing information, and ensuring equitable access to vaccines. The message from experts is clear: we need to take this new variant seriously. What does an infection with the new variant look like? The symptoms might surprise you. The new COVID variant, like its predecessors, presents a range of symptoms that can vary from person to person. However, some common signs have emerged that may help us identify an infection. The most prevalent symptom noted is a persistent cough. This is a trait shared with previous variants and can often be the first sign of an infection. The cough is usually dry, persistent, and can lead to a feeling of tightness in the chest. Another common symptom is a high temperature or fever. This can make you feel warm to the touch on your chest or back. It's important to note that not everyone with the virus will develop a fever, but it's a common sign to watch out for. A significant difference with this variant is the prevalence of a sore throat. This symptom was less common in previous variants, but it's now reported more frequently. It's usually accompanied by a general feeling of discomfort, fatigue, and sometimes headache. Loss of taste and smell, a hallmark symptom of the original COVID-19, is less common with this new variant. However, it still appears in some cases, and its occurrence should prompt immediate testing. Now it's important to remember that these symptoms are not exclusive to COVID-19. They could be signs of a common cold or the flu, but given the current situation, it's better to err on the side of caution. If you're experiencing any of these symptoms, it's crucial to get tested. Remember, These symptoms can appear up to 14 days after exposure to the virus, but most people will start to see signs within 5 to 6 days. And as always, it's crucial to follow the advice of health professionals and get vaccinated if you haven't already. Recognizing these symptoms early is crucial in controlling the spread of this variant. The question on everyone's mind is, how can we protect ourselves and our loved ones against this new variant? And the answer is, by adhering to the tried and tested methods that have seen us through the pandemic so far, we can continue to protect ourselves and those around us. It's paramount that we don't underestimate the importance of adhering to health guidelines. Firstly, wearing masks. This simple act is a crucial line of defense against airborne transmission. Masks, whether they're surgical or cloth, act as a physical barrier to virus-laden droplets, providing a measure of protection for both the wearer and those around them. Secondly, social distancing. Maintaining a safe distance from others, especially in indoor settings, can significantly reduce the risk of transmission. The recommended distance is 6 feet, but the further, the better. Hand hygiene is another key factor. Regularly washing your hands with soap and water for at least 20 seconds or using a hand sanitizer with at least 60% alcohol when soap isn't available can kill the virus if it's on your hands. Finally, getting vaccinated is arguably the most important step. Vaccines have proven to be effective in reducing severe illness, hospitalization, and death. They may not completely prevent infection, especially with new variants, but they significantly decrease the risk of severe outcomes. It's also important to get your booster shots as recommended, to maintain a high level of immunity. In this new age of the COVID variant, public cooperation is essential. We need every individual's commitment to these preventive measures to control the spread of the variant. It's not just about protecting oneself, it's about safeguarding our communities, our healthcare systems, and ultimately, our future. Remember, your actions can make a difference. Stay safe, stay vigilant, and let's fight this new COVID variant together.